A fibroadenoma is a solid lump in the breast, typically non-cancerous, most commonly found in people aged 15 to 35, but can occur at any age in individuals who menstruate. These lumps often cause no pain and are described as firm, smooth, and rubbery, with a round shape. They might feel like a pea or be flat like a coin and move easily within the breast tissue. Fibroadenomas are common. If you have one, your healthcare provider may advise monitoring it for any changes in size or texture. Sometimes, a biopsy or surgery might be recommended to examine or remove the lump. However, many fibroadenomas do not require further treatment. A fibroadenoma is a solid breast lump that often causes no pain. Key characteristics of a fibroadenoma include a round with distinct, smooth borders, easily moved, a firm or rubbery. Typically, a fibroadenoma grows slowly and averages about 1 inch, 2.5 centimeters, in size, though it can enlarge over time. It may be tender or cause soreness a few days before your period, and a large fibroadenoma may hurt when touched. However, most fibroadenomas cause no pain. You can have a single fibroadenoma or multiple fibroadenomas, and they can occur in one or both breasts. Some fibroadenomas shrink over time, especially in adolescence, where they may disappear after many months to a few years. They may also change shape over time. During pregnancy, fibroadenomas may increase in size, and they might shrink after menopause. The cause of fibroadenomas is not known, but they might be related to the hormones that control your periods. There are less common types of fibroadenomas and related breast lumps, which may behave differently from typical fibroadenomas. These include complex fibroadenomas. These can enlarge over time and may press on or displace nearby breast tissue. A giant fibroadenomas. These grow quickly to a size larger than 2 inches, 5 centimeters, and can press on or push nearby breast tissue out of place. Phyllodes tumors. Although similar in tissue composition to fibroadenomas, phyllodes tumors appear different under a microscope and often grow faster. Most phyllodes tumors are benign, non-cancerous, but some can be cancerous or become cancerous. They typically cause no pain. Common fibroadenomas do not increase your risk of breast cancer. However, your risk may be slightly elevated if you have a complex fibroadenoma or a phyllodes tumor. Ultrasound uses sound waves to detect the features of fibroadenomas, especially in women younger than 35 years of age. US is effective in distinguishing solid from cystic masses. On US, a fibroadenoma typically appears as a well-circumscribed, round to ovoid, or macrolobulated mass with generally uniform hypochogonicity. On ultrasound, a fibroadenoma is typically seen as a well-circumscribed, round to ovoid, or macrolobulated mass with generally uniform hypochogonicity. Intralesional sonographically detectable calcification may be seen in about 10% of cases. Sometimes, a thin echogenic rim, pseudocapsule, may also be visible sonographically. In 36% of fibroadenomas, blood vessels were also detected, 60% of which showed increased vascularity. Breast ultrasound is a non-invasive imaging test that utilizes high-frequency sound waves to create detailed images of the inside of the breast. It is often used by healthcare providers to further evaluate abnormalities or unclear areas detected in a mammogram. This test can help in distinguishing between fluid-filled cysts and solid masses, and in some cases, can provide additional information about the nature of a suspicious area. A breast ultrasound is an imaging test that healthcare providers use to take pictures of the inside of your breast. It can allow your provider to focus on a small area of your breast that they need to see more closely. Providers might have you get one after a mammogram to get a detailed look at changes they see, or in addition to a mammogram to screen for breast cancer. A breast ultrasound can show whether a breast lump is a fluid-filled breast cyst, usually not cancerous, or a solid mass, which could be cancer and may need further testing. Your healthcare provider might order a breast ultrasound if they want to get another look at a specific area of your breast that was abnormal, unclear, or looked different than the rest of your breast on a mammogram. You or your provider can feel a lump in your breast. You have a specific area of breast pain. You have dense breast tissue. Your provider may recommend getting an ultrasound in addition to a mammogram as part of routine cancer screening. If you're younger than the recommended age for routine mammograms, providers can also use a breast ultrasound during a biopsy to make sure they take a sample of tissue from the right spot. A pathologist can then look at the tissue under a microscope to diagnose or rule out breast cancer. To get images of the inside of your breast, an ultrasound technician moves a handheld device, transducer, over your breast and surrounding tissues. The transducer uses high-frequency sound waves to take pictures of the tissues and structures inside. The technician uses a computer monitor to look at the images the transducer collects. On the day of your ultrasound, don't wear deodorant or use lotions or powders on or around your breasts. These products can make it hard to get clear images. You also might want to wear comfortable clothing so it's easier to change. During a breast ultrasound, 1. You'll undress from the waist up and remove any jewelry. 2. You'll change into a gown or robe that opens in the front. 3. You'll lie on an exam table. The ultrasound technician will help you get into the best position, lying with your arm resting over your head. 4. The technician will apply a clear, water-based gel to your breast and the transducer. 5. They'll put the transducer on your breast and move it into position to get the images they need. 6. They'll save the best images of the area. They might step out to consult with your provider. This doesn't necessarily mean they found anything concerning. 7. The provider may also come into the room and scan your breast to see the pictures live or in real time. A breast ultrasound takes about half an hour. When the ultrasound is complete, you or the technician will wipe any remaining gel off your skin. A radiologist will look at and interpret the images. Your provider will tell you if you need any follow-up tests or procedures. Sometimes, the provider will recommend a biopsy based on the images. They'll schedule the biopsy before you leave. Breast ultrasounds create images with sound waves, so there's no exposure to radiation. There are no known risks of ultrasound technology, but it's limited. Providers usually use it to see one specific area of your breast. That's why mammography is still the best tool for looking at your entire breast. If you're at an increased risk of breast cancer, your provider may recommend a breast ultrasound in combination with a mammogram for screening. Your healthcare provider will explain the procedure to you. Ask any questions you have about the procedure. You may be asked to sign a consent form that gives permission to do the test. Read the form carefully and ask questions if anything is not clear. You do not need to stop eating or drinking before the test. You also will not need medicine to help you relax. You should not put any lotion, powder, or other substances on your breasts on the day of the test. Wear clothing that you can easily take off. Or wear clothing that lets the radiologist or technologist reach your chest. The gel put on your skin during the test does not stain clothing, but you may want to wear older clothing. The gel may not be completely removed from your skin afterward. Follow any other instructions your healthcare provider gives you to get ready. You may have a breast ultrasound as an outpatient or as part of your stay in a hospital. The way the test is done may vary depending on your condition and your healthcare provider's practices. Generally, breast ultrasound follows this process. 1. You will be asked to remove any jewelry and clothing from the waist up. You will be given a gown to wear. 2. You will lie on your back on an exam table. You will be asked to raise your arm above your head on the side of the breast to be looked at, or you may be placed on your side. 3. The technologist will put a clear, warm gel on the skin over the breast area to be looked at. 4. The technologist will press the transducer against the skin and move it over the area being studied. 5. Once the test is done, the technologist will wipe off the gel. You do not need any special care after a breast ultrasound. Your healthcare provider may give you other instructions, depending on your situation. Thanks for watching.